Hello, my name is Martha. I'm one of the paramedics here. Do you know where you are? Okay, good. Your neighbours called the ambulance here and they've told me that you've had a little bit of a fall. Is that correct? Okay, I'm just going to have a wee look at you, so just stay where you are, okay? I'm just going to pop this down first. I'd like you to just follow my fingers for just a wee moment. Okay. Up here. Down here. Just on the other side. Okay. Okay, good. You're not seeing any double vision at all? Okay. That's good. Get my wee light. Okay. Just want you to just look straight ahead at me. Just gonna do this very quickly, just for a moment. Now, can you tell me your name as well? Okay, good. And your date of birth? Okay. Great. Okay, good. Now just stay where you are because I'm just going to have a look at your arm in just a wee moment, but I'd like to check your head first because you've got a little bit of a grease there. Just don't mind me for just a moment. Now, are you having any trouble breathing at all? A little bit, okay. I'm just going to quickly check your head first and just check that little bit of a graze, because it is bleeding just a little bit. Just put that out the way for just a moment and I'm just going to have a look, okay? Okay, so it's quite a big deep cut. Do you remember what you were doing before? Okay. I've just got to make sure that you're not got any concussion here, okay? Okay, so we'll clean that up in just a moment. Alright, so you're having trouble breathing. So what I'm going to use, I'm just going to give you a little bit of air, okay? Just a little bit of oxygen. So I want you to just stay calm. Just going to use this, it looks a little bit scary looking, but it's going to give you some air and we're going to put this over your nose, okay? Okay, so just put that over your mouth. How's that? A little bit better? Good. So you don't feel confused about anything at the moment, which is good. But you have had a little bit of a fall and your arm looks broken. So I'm going to have a look at that in just a moment. Just let me know when you've had enough oxygen. Okay. How are you feeling now? Okay, good. I'm just going to leave that here just in case you do need to have a bit more, okay? So what I'm going to do now is I just want to have a look at that arm, okay? So just extend your arm out for me, just as best as you can. If it hurts, let me know. It does hurt. Okay, I'm just. Yeah, it's definitely broken. Okay, so what I'm going to do is I'm just going to put a wee bandage over the top, okay? Just a little sling on you, just for the moment. Yes, it's definitely broken. Can't see anything that's gonna damage it. Okay, alright. Well, before we do anything else, I'd like to put the bandage on. Okay. So I'm just going to be using this, okay? Just gently. So what I want you to do is just put this all around here, okay, and put that there. Good. Okay. That's right. Just relax for me. Okay. Okay, great. Alright, so that should be tight. Now just gonna secure that. There we go. Now you're looking a little bit pale. Okay. A little bit more. Okay. Okay, just put that on there again. You're alright. What I might do is I might just inject a little bit of saline, okay, just so you're getting a little bit more fluid in there. Have you been drinking any water? Okay, we can definitely look at that. And I'm just gonna clean up this area first, okay, and put another bandage on there. And then I'll inject you with the saline and we'll just check a couple of more things, okay? Right. Okay. How's that? Okay. Okay. Remember, just let me know if you need it again. I'm just going to take this out and I'm just going to dab along here. Okay. Okay. And doesn't it hurts a wee bit around there, okay. Alright. You're alright. What we're gonna do is we're gonna get you down to the hospital to see one of our nurses and she'll have a look at you and then talk to the doctor. Okay. Okay. a little bit more. Okay, so tap, 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 tap. Tap, 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 tap. Okay. And then what we'll do, just use some scissors and throw that one over there for just a moment. Okay, so if you can just with this other hand, if you can just hold it up for me. Okay, just hold it up for me. And I'm just gonna stick some of this around. Great. Okay, good. Alright, let's go with the ceiling now. Okay, so I'm just going to use a little bit of saline injection. It's okay, you're going to be fine. It's not going to hurt. It's just a wee bit of a pinprick. Okay. So I'm just going to use a wee needle. Okay, so it's just a little needle like that. Alright. Okay. Alright, so just a little bit, okay? And then we'll put on a little bit. Just make sure that comes out. There we go. Alright then. Just let me know if you're feeling a little bit faint, okay? We're just going to put this in you now, okay? Okay. So, 3, 2, 1. Okay. Okay, that's all done. Okay. Okay, great. You should start to feel a tiny bit better. It does have a little bit of morphine in there as well, just for your arm, okay? Okay. Alright, so what I want to do is I just want to check your lungs just to make sure there's no bleeding or anything you're having trouble breathing, because you have said you've had a little bit of trouble. Okay. So I'm just going to put these on here and I'm just going to have a listen, okay? So I'll just put up your top for just a moment. Okay. And just breathe in for me. A nice deep breath. Okay, and out. Great. Okay, and just here. Deep breath in for me. And out. Okay, good. And again. Deep breath in for me. A deep breath out. Okay, good. So what I'm going to do is I'm just going to go round the back of you now and just check round the back, okay? Check your lungs. Okay. So if if you can just take a deep breath in for me. And out. Okay, and another deep breath in for me. And out. Okay, good. And just around to the other side. Okay. Deep breath in for me. And out. And another deep breath in for me. And out. Okay. Alright. So I'm very happy with your lungs, so there doesn't seem to be anything there. And I'm going to have another look at your eyes in just a moment. That'll be the last thing that we're doing before I take you to the hospital. But I would like to check just your blood pressure from having a refill. Okay. Just take my gloves off for this one. So I can only check it on your other arm. Extend that out for me. Okay. 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 And again. Okay, your blood pressure is a little bit high, but that's okay. That is normal. It's not too high, which is good. Just want you to put this into your mouth, okay? Just under your tongue. Just put it under there. Okay. Whilst you do that, just want to have another look inside your eyes. So just open your mouth. Okay, good. And just look straight ahead at me. Okay. Okay. Another wee look. Okay. Again on this side. Definitely no double vision. Okay, that's really important. I just stare at my nose. Okay. Great. And just at the wall for me. Okay, keep looking and just look at my finger. Okay, great. And this side. Okay, just look at my finger. Okay, good. Okay. So what we're going to do is I'm going to take you over to the hospital now because we would like to look at that broken arm, okay? And just your head. Okay? Okay, lovely. Okay, if you'd just like to just stay where you are and I'll pack all my things up and we'll get on the way.